I was married trying to conceive, and after a year of trying, not successfully, went down the fertility medical roads and found that we had unexplained infertility. So that started a big journey of, but why? Why isn't my body working?
I think it is really helpful to talk about it and say, hey, yes, after I gave birth with my second, I definitely peed my pants sometimes, and I came here and I got help. I don't know why there's that shame built up around something that I didn't do anything wrong, and it's not something that was in my control.
My health took a little bit of a downward spiral and I gained a lot of weight. And so although as time went on and my hormones changed as I aged and I started to feel a lot more relaxation in my pelvic floor, I just kind of always told myself, well, once you get back into shape, once you start doing yoga again, this will improve. And I did that now for going on 3 years.
Women's health. It is not talked about enough, especially for those who have given birth. So this week I am sharing real stories of women who took their issues with women's health care into their own hands because they believe that no one should feel alone, embarrassed, and definitely not in pain. So in these stories, we were talking about pelvic floor therapy and the impacts that it can have on your entire body. Tonight, we introduce you to a mother who has been dealing with her own pelvic floor issues. She is also a nurse practitioner and says that access, awareness, and research are just some of the reasons that women have been suffering from pelvic pain for years.
I am a women's health nurse practitioner and certified nurse midwife. I've been both for about 20 years now, and I work in both inpatient hospital settings as well as private practice clinic and federally qualified health center. For me personally, I have been pregnant or breastfeeding most of the last 15 years, and like many people with multiple babies, noticed that my core strength and my pelvic floor strength just really declined over time. After my last child was born, he was actually stillborn. And so I spent a lot of time afterwards grieving, and my health took a little bit of a downward spiral and I gained a lot of weight. As time went on and my hormones changed as I aged and I started to feel a lot more relaxation in my pelvic floor, I just kind of always told myself, well, once you get back into shape, once you start doing yoga again, this will improve.
Hold that breath and vacuum.
I was referring yet another postpartum patient to a pelvic floor therapist, and I realized I would never tell a patient to just lose weight to deal with her pelvic floor relaxation. And so that was ridiculously a light bulb moment for me to actually dedicate some time to this. Like a lot of women, we just dismiss these symptoms as part of life and don't put a lot of attention into it. Coughing, sneezing, laughing can make pee or sometimes even poop leak, and it can also lead to a feeling of pelvic pressure and fullness and discomfort, and sometimes even impact sex, and it can become painful. So those are all kind of things that I have started routinely assessing for women in the postpartum period, which, believe it or not, has not been the standard for that long. I watched the introduction of electronic health records and kind of standard women's health chart note templates. There was no section for asking about incontinence or pelvic pain or sexual pain. It's been something that has not been a focus of research, it's not been a focus of care. It's really left a lot of women kind of suffering for years, feeling like this is just the way that it is. I think too, a lot of women feel like, well, I had a cesarean, so how could my pelvic floor be impacted? And now what we know through research is that a lot of the pelvic floor stretching and damage actually happens from the weight of the pregnancy. I've had patients literally tell me that their life was changed because things they didn't even know that were related to their pelvic floor weakness suddenly improved. Usually back pain, shoulder pain, pelvic pressure. And that is a challenge. I have many patients who can't afford to pay out of pocket and whose insurance really don't cover any physical therapy centers that include pelvic floor work. To realize that women have been suffering for years, it is why I'm a healthcare provider.
spent a lot of time with these women, and I just want to say thank you for sharing your stories. I learned a lot, and I hope you at home also learned a lot too. But if you are experiencing any pain that might be from a pelvic disorder, make sure that you contact your healthcare provider. UCLA Health says that 1 in 3 women will experience a pelvic floor disorder during their lifetimes.